A month or two ago, you probably had never heard of ivermectin, but now the news is full of stories of people who've been taking this supposed horse medicine, hoping to cure themselves of COVID-19 or to protect themselves from the virus as well. And the message from the authorities here in Australia is this is madness, that there's absolutely no evidence that this thing works at all and that you're putting yourself in danger. But on the other side of the world, there are people who've been using it effectively, so they say, in all sorts of dire situations where they didn't have vaccines and they were looking desperately for something that could work against the virus, and their voices are never heard here. So I thought it was about time that we talked to such people. So we got in touch with Professor Hector Carvallo in Argentina, who's been working with ivermectin for a year. Well, welcome, Hector. You're in Argentina and it's your morning, and here in Australia it's getting rather late. We have heard about this study that you did in your hospital in Buenos Aires, and I thought before you tell me how that was done, I'd like to know something about what was your position at that time, your official position, and what were your credentials for doing that study?
Okay, well, good morning for me and good evening for you. I've been a medical doctor for 40 years now, and I've been a professor of internal medicine for the last 15 years till I retired. That was during the pandemic. When the pandemic broke out, when it wasn't still called a pandemic, it was still an epidemic. There was no doubt that it would be a pandemic because it was spreading so quickly that we started collecting all the written material from all over the world, from China, Europe, the places that were struck first, in order to train our doctors at the hospital. Because though I'm retired, I was working as for the continual medical education there, pro bono, I'd say, because I like it. I've done it all my life. So we collected all the materials, and in order to make the doctors be aware of what they were going to face sooner or later.
Right.
Because many times in the past, after the first patient's death, the second death was the doctor's, because he didn't know what he was dealing with. So we didn't want that to happen. And we started collecting hundreds of papers from all over the world. And among those papers, we found one that said that the Australians at the Monash University were working in vitro, that is inside the laboratory, with a compound that seemed to reduce the viral load dramatically. When I say seemed, it's because the article wasn't still finished when we came across it. It was just an idea. And the fact is, the compound they used was absolutely familiar for us because we have been using ivermectin for over 20 years in human medicine in South America. It is used for scabies, it is used for lice, other enteric parasitosis, rosacea, which is a dermatologic issue. So we are familiar with the compound, and we also knew that there had been some studies a few years ago using ivermectin on dengue fever and HIV because it had proved to be also to have also a virucidal effect. So both things that you needed in order to fight against the virus, that is virucidal effect and immunomodulation, were known about ivermectin for quite a long time. So when the new study in vitro was being developed in Australia, we sent emails to them. We received some material as a response. And then we shared a couple of meetings, of webinars with Dr. Kylie
Wagstaff. So, yeah, so it was no surprise to you to find out, to read that she had discovered that ivermectin could kill the virus in the lab. That was not surprising.
Well, at first I'd say that it was not surprising that ivermectin was virucidal. We already knew that, but those were the first studies. Anyone who say that had done in vitro studies before Westhoff, that's not true. She and Dr. Cayley were the first ones. So I told everybody, if the following, the next Nobel Prize should go to them, because the first one who discovered that.
Right.
But later on, there was a kind of a silence, radio silence on all they had achieved. But that happened not only to the Australian researchers, it happened to the American researchers who were studying hydroxychloroquine, the Italian researchers who were using doxycycline and azithromycin, and the other European researchers, the Jewish researchers who were using other compounds like zinc, vitamin D, all of them, including us, have been demonized as if we were
Demonized.
Yes, that's a word, demonized, because we wanted to do something. And
Well,
I can tell you that the worst thing you can do when in front of people's suffering is to do nothing.
Yeah. So you must have very quickly put Dr. Wagstaff's discovery to the test with people, didn't you? I mean, how quickly did you do that?
In less than a month.
Less than a month after you got the news, you were testing it on people.
We did so. And we were so glad, so optimistic on that, because the results were very promising, that the other colleague that worked with me was absolutely, how can I say it? He was glad. He said that we can get rid of all these, we can get rid of the lockdown, we can get rid of the suffering so easily. And then, well.
Then it went dead. Did you tell Dr. Wagstaff of your findings?
In one of the last webinars we shared, we talked about that.
Well, she must have been excited to get this news, was she? Do you remember?
She was so enchanted to know that her achievements have been useful. Yes, she was. And I guess she is still, but now she must be discouraged because of all that happened in between.
Yes, because it seems so strange that while you people in Argentina and other countries were racing to test this thing to see if it worked, she was either not allowed to do that or for some reason she didn't. And now a year has passed and we're just finding out that some sort of study was done. Nobody can tell us what it was. We can't see it. We can't get a date on it. So the whole thing got squashed here.
Yes, and longer than a year and a half, I'd say, by now. That has already passed.
So we could say that you turned to ivermectin in part because you knew that early treatments would be important and that you wouldn't be getting a vaccine. Is that correct?
Early treatment is always important. If I have a lung tumor and I go to the oncologist and he says, well, yes, you have a lung tumor, but I will wait till you have many metastases in order to start treating you. I get another oncologist because he's crazy, he's a criminal. Early treatment is a secret to succeed in every disease, in every circumstance. It's not anything new that I am saying. It's a dogma of medicine. The earlier you treat a patient, the more chances you have to be successful. As simple as that. But let's go back to the initial study. We had 135 subjects with mild COVID that received the medicine as an early treatment, and not a single one had to be referred to the hospital later on. That is, their condition improved and they didn't get worse, and they didn't have to go to the hospital anymore. And from the ones that were received in such a moderate or severe condition that they had to be admitted at once, we proved that we just had one death out of 32 patients. That is far less than the average stand that we had in those days, because in those days, anyone who entered the hospital had a 21% chance of not leaving the hospital, at least not alive.
But you were curing people in intensive care.
We treated people moderate and severe, and the severe were in intensive care unit.
It's interesting, the Wagstaff study had no indication that ivermectin could be used prophylactically to prevent people from getting the disease. So why did you come up with the idea that it could do that?
Well, because it was a possibility. So whenever you treat a person, you are going to say that early treatment is better than late treatment, but also that prevention is better than treatment. That's what we called the pre-exposure trial.
So once you'd made that decision, although you were retired, you still had access to hospitals, right? And so you were able to set up in the hospitals in which you used to work, I suppose, you were able to set up some studies with healthcare workers, frontline workers. Is that right?
That's correct. We did it at the very beginning. We discussed that with the authorities of the hospital, and we came to an agreement through the ethics committee of the hospital and also the ethics committee of the county. And then we started. And they were so excited as we were. They even held a press conference to let everybody know that we were going to start a trial when nobody was starting any other trial in Argentina.
Where did you get the ivermectin?
We borrowed all the free samples because you know that ivermectin is a very interesting compound. It has no owner because the international patent has expired some years ago. So anybody can manufacture ivermectin. In Argentina, there are 4 companies who manufacture ivermectin. We got in contact before starting. We had to have the compound.
Yeah.
So we contacted the 4 companies to get free samples. Well, from the 4 companies, 2 companies never answered us back. They didn't help us, but 2 other companies gave us lots of free samples. When we had that, when we were sure that we will cover 1 month trial, we started the trial. But it was pretty quick because the other colleague who works with me, who is a professor of infectology, he went to one company and the other with his car collecting the samples. That's what we did.
Now, those were fairly small studies, those first 2, weren't they? I think 200 people or something like that. And they were frontline workers, right? They were people in contact with sick patients. And I guess you'd been very worried that, you know, you can't afford to lose your frontline workers, can you? You have to keep them healthy. So it's very important that you find something that protects them.
Yes, we were happy to do that because we wanted our colleagues, the ones that were working in the front line, in the trench, as we call it, the trench, to be protected, because they had the external protection, but that was enough. Because if it had been enough, no healthcare worker had contracted the virus, and they were contracting the virus. So there had to be something not only on the outside, but in the inside. So we started with 229 healthcare workers. That was some people consider that a small figure. When you save one life, for that person and his beloved ones, it's 100%. So figures are relative. But the fact is, after that, many other workers, healthcare workers, wanted to participate not just as a trial, but to protect themselves. So we had to borrow 10 times the free samples we had borrowed at the beginning. The companies were reluctant to do so because they didn't know if it would work. So because the outcomes were not available yet. But after insisting and insisting and insisting, and in order to stop us insisting, they gave us the free samples, and so we could go on.
Now, I have heard criticisms of your studies that they weren't done with the proper standards. For instance, they weren't double-blind studies and they didn't use placebos. Were there reasons for that?
Well, the fact is, they were. I have to concede they were very humble studies because they were observational. They were not randomized, double-blind, or against placebo. Because in a potentially lethal illness, people who receive placebo are more likely to die. So proving our theory on a pile of corpses is something that's not only unethical, it's criminal, okay? And they were not randomized or double-blind because in order to give any so-called experimental compound that had not been accepted worldwide, you have to sign a consentment, okay? So you knew what you were receiving. The doctor who convinced you to use it knew what you were receiving. So it's impossible to work in a double-blind way. But anyway, let's take for granted that there are two different ways in which you can perform an investigation: randomized, double-blind, placebo, whatever, or observational. But if you have an observational study that may be more humble than the others, if you have an observational study that worked, what you have to do is not to disregard it because it's just observational. You have to make it bigger and bigger and more perfect, if you want to qualify it, in order to prove it right or to prove it wrong.
So to keep on track here, you did the first two studies in the two hospitals, and then you did this much larger study. Can you talk about that one?
The larger study was the continuum of the second study, the one that was performed in the outskirts hospital, and that included almost more than 1,100 people, healthcare workers. And the results were the same. And we did it for a longer time, that is for almost 3 months, and the results were the same. It may be funny to a certain extent, but the word was spread that ivermectin worked. So many other colleagues wanted to use it, because when the word was spread, there was nobody who didn't want to use it. Even the authorities of the hospital called us and said, we are in trouble because everybody wants to use ivermectin and we don't have ivermectin. That's when we started collecting piles and piles and piles of free samples. And that's when we came to the larger figure.
And so that larger figure, out of the 1,000+ people, how many got the illness?
From the ones we used ivermectin, not a single one.
Really? And these are people in direct contact with sick people every day in the hospital?
When we say healthcare workers, we mean people who are in touch with sick people. They may be medical doctors, nurses, the ambulance chauffeur, or the woman who cleans the emergency room. But they are all healthcare workers, and they are in direct contact with sick people. Okay, and that's what we did. But in the meantime, though we have followed all the phases to ask for the ethical committees to give us permission to do so, for the county mayor to give us permission to do so. When we finished the whole study and we were about to publish it, we received a communication from the Ministry of Health of the province of Buenos Aires saying that they didn't want us to keep on researching on ivermectin.
Oh.
And it was. They also told me, if you keep researching on ivermectin, you are going to lose your job. And
Really?
I said, it's hard for me to lose a job because I'm retired. You keep your hospital. It's on your conscience what will happen to the healthcare workers there, but I don't want to fight the power.
But surely word would spread through the population. The demand for ivermectin would be appearing everywhere, wouldn't it?
Yes, and that led to self-medication. Hundreds of thousands of people started purchasing ivermectin and using them on their own. And that led to another problem, because no doctor may support self-medication. Fortunately, ivermectin has a very large safety
margin.
Yes, so it's almost impossible to get intoxicated with ivermectin. But if you use too little, it may be not precisely useful for you.
I mean, with all this success that you had in your hospitals, did this not spread all over the country? I think it did not, did it?
Only to 5 provinces. Argentina is divided into provinces, not states, provinces, but they're the same. 5 provinces have adopted ivermectin officially, either for prophylaxis or for treatment. They are the provinces that were doing better than the others. In spite of that, they didn't adopt ivermectin all over the country.
You say only 5 provinces out of 25, I think it is, in the whole country?
24.
24. Only 5 provinces have adopted this, but you would think that your results were so impressive and so fascinating that many more provinces would have got on board.
I thought that it was a matter of time. They will go one after the other. I was wrong. After vaccines showed up, many healthcare workers preferred to use the vaccines. which is right. It's a wise move, because if you have a vaccine, why not trying it? But some of them kept on using ivermectin, and some others stopped using ivermectin. So from those, though I don't have the figures because we didn't make a follow-up for a whole year, we know that some people who were vaccinated contracted the virus later on.
But I find that hard to believe, Hector, that people would have preferred the vaccine, because the vaccine was experimental, is experimental. The ivermectin is not experimental in terms of its safety. It's absolutely proven to be safe. So why wouldn't you choose this pill, since you'd had such wonderful results, over the vaccine?
Well, one thing is for fear. When you are told that this pandemic is the end of the world and nobody will survive, and your children are in danger, and well, and you started listening to that all day long. It doesn't matter if you are a medical doctor or you are not, you get scared. And when you said, well, I have a vaccine which is 99.9 effective, though it is experimental, you may give it a chance. I'm not against vaccines, but I'm not in favor of experimental vaccines, because something which is experimental should not be mandatory.
No.
And because it's just experimental. In the old days, by trying an experimental drug, you had to go to prisoners in the jails, and you had to commute their permanence in jail
Sentence.
if they accepted the sentence. Yes, if they accepted to be volunteers. Now they are getting volunteers everywhere just because they have convinced them that otherwise they will die. And that's not true. So through coercion or through fear, they have convinced a lot of people.
But I was just thinking, if Australia was to show some interest belatedly in ivermectin, is the way to dip the toe in the water perhaps to just free the doctors in this country? There's only 2 doctors I know of that are openly prescribing ivermectin, maybe 3. So maybe to dip the toe on the water, you say, well, any doctor can prescribe it, and let's see what happens. Would that be a sensible opening move?
I think so, and in not only Australia, anywhere. You should be free to do something. Let me give you an example. Just suppose you turn around the corner in your neighborhood and you see a house in fire. There are many things you can do. You can play the hero and try to save the victims yourself, which is risky, of course, because you may become another victim. You may cry out for help. You may call 911. You may get a garden hose and try to put out the fire. There are many possibilities, but there's only one possibility, one behavior that is not acceptable, and it is to do nothing, to pass by as if nothing happens. And this is what doctors are told to do, nothing. Keep the patients at home with a couple of pills of Tylenol that doesn't work at all, and until their condition gets worse, until they cannot breathe properly, until the oxygen concentrations go down, and then refer them to the hospital. That's crazy. That's not the way the medicine has been working for the last 200 years.
So the doctors, they must be very conflicted, those who've done some research and secretly suspect or know that ivermectin could be very useful. They must be feeling so anguished and so torn. that they can't or won't subscribe it.
Many of them have a very great dilemma between doing what the conscience tells them and risking their job.
And now, of course, the healthcare workers are faced in this terrible situation that they're told by the end of next month, if they don't have vaccines, they lose their job. And what a choice that is.
It's coercion. It's coercion. Okay.
Yeah.
Well, there are vaccines which are mandatory in any country. There are vaccines which are volunteer in any country. But this is the first time that experimental vaccines have become mandatory.
But it's actually illegal, isn't it, to make mandatory an experimental drug?
Any law in any country. But anyway, it happens. And everybody seems to be happy with that.
Yeah. Well, we'll see what happens. We're trying to get to 80% vaccination with the idea that suddenly things will be magically different. But I think the case of Israel and Iceland shows us that that probably won't be true.
They have reached, theoretically speaking, once again, theoretically speaking, they should have reached herd immunity through artificial methods, namely vaccines. But that wasn't the case. So I may tell you, this is the right thing, this is the right thing, but on the battlefield, it's not the right thing.
Yeah.
All truth passes through three phases. First, it is ridiculed. Second, it is violently opposed. And third, it is accepted as self-evident. The fact is that we are in phase 1 or phase 2, now in phase 2. But the time that it takes from reaching phase 3 is counted in human lives, not in minutes. That's what drives me crazy.
Yeah, I understand. Well, as I say, people like yourself are never consulted. You are never invited to our media. But I'm sure if you were invited to testify on a Zoom session, even to take the oath, you would do that, wouldn't you?
Of course, because what I'm saying is what I have seen, what I have proved, what many other researchers have also proved. And why would I be intimidated not to say the truth in front of any court of law?